So that was one of my other questions. Is laser, is that a good, or what are some other um, technical conditions that can be treated with other items?
So first of all, one of the common characteristics of rosacea, again, is telangiectasia, those dilated capillaries. So even if you get the disease, you're able to manage it and manage the appearance of the redness. The telangiectasia in some people can be quite obvious, and as they expand and contract, then it's something that it visually is difficult to cover. What you can do for that, and this is not something that's going to make the disease go away, but there are lasers, for example, something called intense pulsed light,
Okay.
IPL.
PL.
IP is in Peter L. Now, intense pulsed light, everybody refers to it as a laser, but it's not a true laser, it's a light source. So it's done
Oh,
with the supervision of a physician. In California, for example, you have to be at least an RN and up. Most states you have to be to do one of these devices, to work with one of these devices. And what it does is it's attracted to either red or brown. It doesn't remove skin. It's not ablative.
hmm.
And when it's attracted to the red, it literally shuts down
The red.
those expanded vessels. Now, it takes about 3 to 5 treatments, and they're usually spaced anywhere from about 4 to 6 weeks apart. They're not real expensive. I'm going to say around the country, in general, it could be anywhere from $200 to $300 per treatment.
Oh, wow.
So at the end of 5 treatments, most people really have a tremendous
Result?
result in the appearance. It's not permanent.
Oh.
So you have to keep it up because it might be maybe you go back for a treatment every 6 months or once a year. Depends on the individual. And of course, managing it is going to make a big, big difference.
Right, and making sure that you're on the system. That's one of the things that I
Mm-hmm.
find it gets frustrating. You know, they just want to go for the big guns and go get the laser, but then they're not willing to stay on the maintenance. It's like, are you still using it? No, well, no, I'm going to go get this done. It's like your results are going to be no better than your management. You've got to make sure that you are staying true and using your management system, using your BioClear, using your Siesta, and now you're going to use Rosalie, because why would you undo something that needs to be supported with everyday
And
home care?
and Sue, let me tell you, Rosalie was actually presented at podium at the largest medical laser conference in the US. This was back before COVID. It was like last October or a year ago October when people were still going to conferences.
Yeah.
And so the study on Rosalie was presented by one of the top laser docs. And what they found is that using Rosalie, um, for your home care along with the system, but using Rosalie, and also if you do it in combination with laser, that you actually have the same result or better after 1 or 2 laser treatments than you did if you did 3 or more.
Okay, good. There's a question. It says, can you use Rosalie to decrease the number of IPL treatments?
Well, like I said, the study showed that the result was there with fewer treatments. However,
Oh,
I recommend doing your full laser, the full round of treatments, because you're just going to have an overall better result progressively going forward. But this is something, again, you've got to manage this issue every single day. You have to manage
right,
the appearance of redness.
right, right. Well, that's some great information. So you've talked about there are some different types of rosacea. And